Aids for the Cessation of Tobacco Product Use. Delegate Bandari.
Thank you, Madam Chair. For the record, I'm Delegate Harry Bandari, presenting House Bill 28. The research shows that smoking is the leading cause of preventable death in the United States and around the world. The finding also shows that most smokers want to quit. With the House Bill 28, Maryland would take a step toward helping them. With this bill, we would save lives. House Bill 28 would grant licensed pharmacists the right to prescribe and dispense nicotine replacement products approved by the U.S. Food and Drug Administration as tobacco cessation aids. Our state law already covers tobacco cessation medication and services offered by licensed healthcare practitioner with Medicaid and the Maryland Children's Health Program. House Bill 28 would simply expand access to those services by extending the same provisions to licensed pharmacists. Though there are over the counter options for nicotine replacement therapies available for purchase, financial barriers can prohibit some patients from purchasing these products. A 2 week supply of patches can cost $30 to $45, while a pack of cigarette average about $7. So if someone has a dollar bill in his or her pocket, which product are they more likely to buy? With a prescription, however, most patients can get nicotine replacement therapies with $0 copay. Lower income people currently have a harder time accessing nicotine replacement therapies. Meanwhile, people in minorities communities face disproportionate health impact from nicotine use. We have research showing that smokers in minority communities are less likely to use counseling and medical support to help to stop smoking, and they are more likely to die from related complications. Keeping in mind the addictive nature of nicotine, which has been compared to cocaine or heroin, and the stigma attached to addiction, it seems to me that people with tobacco dependence need our help and support. This bill passed unanimously in the Senate Finance Committee and on the Senate floor in 2020. It was referred to this committee but did not get a hearing due to the COVID-19 pandemic. Prior to the pandemic, however, feedback from several rounds of hearing was worked into the legislation, authorizing pharmacists to provide tobacco cessation aids is safe, and the CDC has stated that the use of this product is appropriate for most adult smoker. Each year, we spend billions treating individuals for preventable diseases related to smoking. With this bill, we could substantially decrease this tax dollar expenditure and improve the quality of care and health outcome. Currently, 14 states have similar statute or regulation for pharmacists to prescribe and dispense smoking the cessation aid. So SB 21 would address a double A's inequity and help more Marylander quit smoking and improve their health habit. Reduced smoking rates would curb the impact of chronic disease such as high blood pressure, diabetes, heart disease, lung disease, and many type of cancer in our state. I would like to request a favorable report on this bill that support our vision for healthier Maryland. Thank you, and I would like to yield the rest of my time to Dr. Galia Santos, and my thanks to those joining us today to testify in support of this bill. Dr. Galia Santos.
Thank you, Delegate Bandari. So let's make sure to add the extra minute. We'll just do it in our heads if it's too hard for Richard to do them back to back. But Dr. Galia Santos, go ahead, and you can have 3 minutes. Is Dr. Galia Santos here? If not, we have a number of other people.
Kate would be the next person.
Kate?
Yeah,
Kate is present. She is under the name
Catherine Berdowski?
Yes.
Let's hear from Catherine Brodowski.
Good afternoon, Madam Chair and members of the HGO committee, and thank you, Delegate Bandari. My name is Catherine Brodowski. I'm a clinical pharmacy specialist in oncology at the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins Bayview Medical Center. I'm also a panelist on the National Comprehensive Cancer Network, or NCCN, smoking cessation guidelines, and hold a national certificate in tobacco treatment practice. I give this testimony as a resident and practicing pharmacist, and I am not representing the view or position of Johns Hopkins Medicine, their cancer CCN. I am a proponent for having increased access to smoking cessation services and decreasing out-of-pocket costs to preventative care services to populations that are disproportionate, and therefore I strongly support House Bill 28. I practice tobacco treatment in my daily role, and my providers reach out to me to create smoking cessation action plans for our patients. And I penned regularly appropriate prescriptions to our providers to sign to address our patients' evolving tobacco dependence needs. Occasionally, our providers forget to sign and send those penned prescriptions for dispensing, which leads to patient dissatisfaction and loss of critical momentum towards change. Indifference and apathy can dull the urgency of the message that a tobacco-free lifestyle is vital, and this message should be consistent from all healthcare providers. When I tell my patients that there's data to support them quitting now at a diagnosis of lung cancer, that it can help them tolerate their treatment better and make them less likely to have a recurrence of their cancer, they lean in a little closer. What message do we want to send to our patients? This bill has evolved over years with one goal in mind, and that's to create better access to smoking cessation resources for our patients, make them affordable, and make quitting just a little bit easier. This bill addresses pharmacists prescribing nicotine replacement therapy. There are 5 FDA-approved nicotine replacement therapy products: the patch, the gum, the lozenge, the nasal spray, and the inhaler. And most of these are available over the counter and would not require a physical exam for a patient to initiate on their own. Part of the rationale for prescription NRT is the unique opportunity for pharmacists to provide counseling on correct administration. Administration not intuitive can actually lead to increased side effects, which can deter progress for patients' smoking cessation journeys. Therefore, having pharmacists specially trained in the counseling and education of these products to be a resource for patients is a natural role and responsibility, and I encourage the committee to support HB 28. Thank you.
Thank you, and thank you for being so sensitive to your timer. Let's hear from Kristen Watson. Is she here?
I am.
Perfect.
Awesome. Good afternoon, and thank you for having us today. My name is Kristen Watson. I'm an associate professor at the University of Maryland School of Pharmacy, and I've been a cardiology pharmacist for the past 15 years. I also serve as the chair of the Heart Disease and Stroke Committee that is part of the Maryland Health cessation and prescribing smoking cessation aids in that practice settings. Pharmacists are well positioned in both the ambulatory care and community pharmacy settings as medication experts through their doctorate degree. The core and trustful professional activities that have been developed through the American Association of Colleges of Pharmacy state that new graduates at a minimum are able to independently develop a treatment plan with patients, provide education, determine monitoring parameters to assess the safety and efficacy of therapy. And pharmacists also need to be able to implement a care plan, including assisting with behavioral changes through motivational strategies. That is essential for helping our patients to quit smoking. The National Comprehensive Cancer Network, the American College of Cardiology, all recognize pharmacists in their guidelines as essential members of the smoking team. And the recent cessation report surgeon to other healthcare providers can treat nicotine addiction as well as others.
Are you done? Do you need a second to wrap up?
I have one last sentence. Thank you. So our goal is to be able to spread these clinical responsibilities amongst healthcare workers and empower pharmacists to work at the top of their license. And by supporting one another, we can do our best to support the patients that we serve.
Thank you so much for your testimony. Is Meredith Sylvester?
Yes, I am. Thank you so much. My name is assessed, treated, and counseled over 80 patients for smoking cessation under the guidance of my pharmacist preceptor. Smoking cessation is not clinically difficult in comparison to other pharmacotherapeutic topics in standard ACP accredited pharmacy schools, such as infectious diseases or oncology or psychiatry. In the eyes of patients, it is a critical challenge that needs ongoing, consistent support and mentally difficult to navigate. Time to nicotine replacement therapy in hand is crucial for patients who gather the motivation to quit. In some instances, there can be days of lag time between when a patient receives counseling to when their prescription is filled. Providers are understandably extremely busy and forget to sign pending prescriptions if they are not the ones seeing the patient. The efficacy of nicotine replacement therapy is directly tied to proper administration technique and repeated counseling. These products to details. We improve successful quit attempts by troubleshooting adherence or administration challenges and educating patients. Small changes can make a big impact. I had a specific encounter with a patient that had smoked for many years and had multiple quit attempts, but was looking for direction, help, and what to do. I counseled the patient on different options available and came up with a care plan. Prescription and requests were sent to the doctor to be signed and covered by the patient's insurance. But as time went on and I had called back for a follow-up, the patient still hadn't received any NRT and was therefore still smoking. One of the pharmacists I was working with at the time then had to reach out to the provider again, asking for new prescriptions to be signed. A one-day process quickly turned into a 2-week cycle, all while the patient continued to smoke. This is a clear example of a patient motivated to quit smoking and would have benefited from a pharmacist prescribing smoking cessation aids. Thank you.
Thank you. I hear that Dr. Galiet Santos is here now. So are you here, Doctor?
Yeah, I'm here.
Perfect.
Yes.
So let's hear from you now.
Fantastic. So my name is Dr. Panagis Galiet Santos. I'm a pulmonary and critical care doctor at the Johns Hopkins School of Medicine. These opinions reflect me and not the university or the school. I'm also the director of the tobacco treatment clinic at the Johns Hopkins University School of Medicine. And everything my colleagues have said, what I'm going to add is actually just a real world experience that has been displayed very evidently during the pandemic. In our clinic, per se, our patients' smoking consumption and relapse rose over 200%. The pandemic has really impacted many people, and with their mental health consequences, smoking increased, as I said, over 200%. With that said, the amount of providers who are able to care for people who smoke, who see tobacco dependence like any other disease, where quitting isn't the only goal, it's staying quit, preventing relapse, managing them, using pharmacological tools appropriately. The amount of healthcare professionals who are out there who can do that effectively is small, is limited. We need to bring in as many people, as many healthcare professionals to the table to care for these vulnerable populations, or else we're going to just fail them. And the amount of stigma and judgment they face already, and supplement that with limited providers, this patient population in of itself feels already disadvantaged and has medicine's trust broken several times. So I'm all favor for my colleagues in pharmacy to be able to assist with us in the ability to care for these patients effectively and be able to reaffirm medicine as a public trust by having them access as many qualified healthcare professionals as possible to help them manage their tobacco dependence. Thank you.
So much, Doctor. And we have one more witness to testify in support. That's Blair Innes.
Good afternoon. My name is Blair Innes, and I'm the Senior Staff Attorney at the Legal Resource Center for Public Health Policy, testifying in my individual capacity in support of House Bill 28. Health equity is a long-standing core value of public health, and in fact, one goal listed in the Healthy People 2030 framework is eliminating health disparities, achieving health equity, and attaining health literacy. COVID-19 has shown that we need more action around health equity, and pharmacies and pharmacists have really been part of the solution. The scope of practice of pharmacists has been expanded, and the CDC reported on September 23rd, 2021, that over 70% of current COVID-19 vaccine administration is occurring in pharmacies. But even before the COVID-19 pandemic, pharmacies have committed to leveraging their convenience as far as distance and accessibility, and their trust that they've built within the community to break down access barriers and promote health equity. Provided chronic care management for things like diabetes and cardiovascular disease, support behavioral health conditions, mental health and substance use challenges, and the list goes on. Pharmacists have already to do more and are so often over in the midst of a kind during the H1N1 outbreak when the pharmacist scope of practice was expanded to administer the vaccine. Most recently, we're seeing it now with the COVID-19 pandemic. And every time, the number of tobacco-related deaths in Maryland is no exception. Passing House Bill 28 is a sound public health decision.
Do we have questions from the members of this bill? I see a question from Delegate Saab.
Thank you, Madam Chairman. And thank you, Delegate, for putting this bill. I understand. So just so I understand this bill, right now, if you want to get smoke cessation, you have to go to your primary care physician, and they have to prescribe the primary care physician, and I can go to the pharmacy who prescribe for me nicotine cessation product. And
Kate, you want to that question, or should I answer that?
Take that question. Thank you, Delegate. And thank you for your question. The current process for patients who are interested in smoking cessation, local pharmacy that sells any nicotine over-the-counter nicotine replacement therapy product and pick it up on their own, read the product, or they can talk to their healthcare provider and see what their healthcare provider recommends. But this is not necessarily bypassing the primary care providers in this instance. It is a mechanism to help decrease the use of the product and expand the access to the product as well. The Delegate Bhandari just already, and if that occurs, then the patients are less likely to utilize them because the high cost out of pocket. Did I answer your question completely?
No, not really. So basically, this is one way to bypass or have the insurance pay for it instead of the patient pay out of pocket. So you still have to go to your doctor too. So if you're going to consult with your doctor, why would you need to skip the doctor? One of my some of the common side effects, and obviously, quitting smoking has a lot of side effects by itself by not doing it. So I strongly support people quitting. Nausea, dizziness, feeling anxious, jumpy, irritable, grouchy, angry, trouble sleeping, trouble concentrating, increased appetite, weight gain, constipation. Taking the primary care out of this. The pharmacist has other underlying condition. They're not looking into that, and it might cause more issues. And I'm just trying to figure out: are we trying to take the doctor out, or are we just trying to get the insurance companies to cover it? And we can do both without still have the doctor, the primary care, have them still make sure that it's an informed decision, and then maybe that's the different bill or different something for having the insurance companies cover it.
So to hopefully answer your question, this does not completely eliminate the primary care provider. Actually, as part of this bill, the refer the patient back to the primary care provider so that and any initiation of new medications during these counseling visits. The side effects that you actually read off are compounded by the fact that those side effects are also are also potentially withdrawal symptoms of patients who are trying to quit smoking as well. So actually withdrawal symptoms included in the discussion process, but it's that initiation of the getting nicotine replacement therapy in the hands and to be able to start it, which helps start their smoking cessation journey.
Right, that's what's troubling to me.
Delegate Saab, I appreciate you had your succinct follow-up, and we'll probably discuss this in subcommittee. I think that we have more questions from Delegate Kerr and Delegate Rosenberg.
Okay.
Delegate Kerr?
Thank you, Madam Chair. I read the opposition letter from the Board of Pharmacy, which is listed as unfavorable, but it looks more like it's. I was asking, but I would like to.
Delegate Kerr has frozen.
His opinion on the issue that Saab raised. Did you miss the last part?
Yeah, I think Delegate Kerr, we missed most of your question. If you could repeat it.
I was just trying to question, but asked Dr. Galiatos if he would respond to the issue that Delegate Saab brought up.
Madam Chair, may I respond to that?
Please.
Yeah, in 2020, we have a few doctors on the Senate as well, and it passed unanimously. This question was brought and it was answered. And to Delegate Saab question, it is accessibility issues, right? The people who has money, they can still buy this medicine over counter, right? And if you don't have money, you have to go through all these things. And if we pass this bill, these vulnerable populations also can get can quit smoking. The people who has money, they already have this. And sometimes when you go to pharmacies, they give the number and you can collect the free medicine. And this is a CDC approved medicine. So yeah, and frankly speaking, it passed unanimously on the Senate.
Thank you. We have questions from Delegate Hill, Delegate Rosenberg, and Delegate Bagnall. Delegate Hill.
Thank you, Madam Chair, and thank you all for your advocacy on behalf of the smokers. And it looks like this bill is closely patterned on the pharmacist prescribing birth control. So I'll try and ABC it, so it's sort of one question. With birth control, the argument was made by the OBGYNs that prescription birth control ought to be available over the counter. And since that was the argument, that was the basis of saying that pharmacists, being, as you said, medication experts, were adequately qualified to recommend or prescribe prescription items that ought to be. I'm not clear that we're talking about tobacco products or nicotine cessation products that are over the counter or are prescription items because the FDA has deemed them to be prescription items, in which case experts is not the same as being a medicine expert. So I think if you could clarify that. The other thing is you spoke to the longstanding partnership between pharmacists and physicians, and I guess nurse practitioners, where we do communicate and don't work in isolation. And times when we get recommendations from pharmacists for medications, you may want to bring the patient in and see them or evaluate them. So we might not respond within 24 hours for a record that was given, but you said it's important for the physician to be involved, but you think it should be after the fact. And I'm not clear with the percentage of folks in the US having decreased who are smokers from 21% 15 years ago to 14%. This is not a pandemic moment. It's not the same kind of emergency as other things. And I'm not clear that it comes to the level that we need to bypass the physician input in making recommendations about prescribed medication. So those are the ABC questions, if you could address them. Thank you.
The intention of this bill is, Delegate Hill, to decrease the annual tax dollar expenditure and improve the quality of care and population health outcomes. Like a lot of minority populations, as you said, that we are, we don't have an emergency. I seriously think that we are still in emergency, because now, like this time, like if you are suffering and you think that you have COVID, and you call the doctor, right? And they said that, no, we're not available and we are going to send you the kits, right? And it comes after 2 weeks. I went through that situation. Like if we pass this bill, and they will have it's not only accessibility issues, right? As Kate said, right? We are not bypassing here, but it is costing a lot of, not only money, like so many, being a doctor yourself, you know that this smoking habit is not only costing a lot of money, millions of dollars to our state, but we are losing so many of our constituents. So this is not just the accessibility issues, it is a health emergency issues.
Thank you. And just let me add, Madam Chair, that no disagreement there. But again, the counseling that is so important that pharmacists can still do does not require that they also be able to prescribe. So they can certainly counsel, refer back, primary care. Is that not correct? So thank you. I appreciate that. And I appreciate the intention of the bill.
Delegate Rosenberg, your question.
Thank you, Madam Chair. If I heard correctly, there are existing instances in the law when we allow for this kind of service being provided, give this authority to the pharmacist. Is that correct? And if it is, what are those instances?
There are no instances in Maryland of relating to nicotine replacement therapy. There are other, what we would say, similarly situated medications, such as birth control, that are allowed to be prescribed by pharmacists. And there are instances in at least 14 other states where pharmacists do have this authority.
Thank you. That's very helpful.
Delegate Johnson.
Thank you, Madam Chairman. This question is for Kate. It's a two-part question. So if you have money and can afford it, you do not have to get an exam. You can come in and buy these products. However, if you're low income that's the main reason they go get a prescription, because you have to get a prescription for it to be covered by insurance. And some of the side effects that Delegate Saab talked about, are they not lessened or alleviated with the nicotine replacement products?
Yes, they are lessened and alleviated with the nicotine replacement products, because you are the nicotine withdrawal is what brings on some of those some of those symptoms. And by providing purely nicotine through nicotine replacement products, you help to soften some of those symptoms that those patients go through in their withdrawal.
You can
then for if you do have insurance, then that can help alleviate some of that cost burden.
and you must have a prescription for the insurance companies to cover that.
Yes.
Thank you. Thank you, Madam.
Absolutely. I don't see any more hands raised. I'm giving you all a second, just in case. Perfect. So no more questions for this panel. Is Sarah Price from the Maryland Chain Drug Stores here to testify, or is that just an amendment we have in our file? I don't see her here, so I will, there's an amendment from them in the file, and there is an amendment from the pharmacists, as well as the two unfavorable letters that were mentioned, but we don't have any oral testimony for those panels, so that will conclude the hearing on House Bill 28. Thank you.